Hello friends, welcome back to Complete Medical Coding. Today I'm here with some more questions, okay, from the respiratory system. Alright, some guidelines and more questions which is related to respiratory system. So as you all know, the respiratory system that is from 30,000 series. Okay, that is a 30,000 series. So let's discuss the guidelines and more questions today. Friends, if you are new to the channel, please support me by subscribing to the channel. And moving to the first question. A patient suffering from chronic inflammation of the maxillary sinus underwent a surgical endoscopic transnasal balloon dilation procedure to restore normal sinus function. During this procedure, maxillary antrostomy with removal of tissue was completed. How should you report these procedures? So here, chronic inflammation of maxillary sinus. Inflammation of maxillary sinus. Okay, so the patient is having chronic inflammation of maxillary sinus, and then the patient underwent a surgical endoscopic transnasal balloon dilation procedure. Okay, and then during this procedure, one additional procedure is also performed, that is maxillary antrostomy with removal of tissue, that is also done. So these two services you have to code. All right. So moving to the options one by one. Open a CPT code book. Since this is 30,000 series, you can directly go to 30,000 series. Anyway, in your examination also it will be like that. It is the I think I had already done CPC examination pattern in the last month, I think. So like if you can check few videos before, you can see that CPC examination pattern. In that also they will be the questions will be asked like in the series only, like 10,000 series, 20,000 series. It's in the order. So accordingly, you can use the CPT code book. Okay. So like that, you can save the time. Anyway, going to first code, first option 31295. What is 31295? Nasal or sinus endoscopy surgical with dilation of maxillary sinus ostium. Example, balloon dilation, transnasal or via canine fossa. Yeah, this is by balloon dilation, nasal endoscopy only. So this is what we need. Transnasal by balloon dilation. Okay. So surgical endoscopy, nasal endoscopy. And then what is the other procedure carried out here? During this procedure, maxillary antrostomy with removal of tissue was completed. So we need to code that also. So anyway, in the first option only one code is there. Just keep it there. Don't skip it, but keep it there. Now moving to second option B. Let's find out what it is. See, in option B, two codes are present. The same as in option A, 31295, it is marked as secondary code along with modifier 59 to represent it as a distinct procedural service. And what is the first code? 31267. Just check what is 31267. 31267. 31267. Nasal or sinus endoscopy surgical with maxillary antrostomy with removal of tissue from maxillary sinus. This is the code. This code also we needed, right? During the procedure, as mentioned in the question, during the procedure, maxillary antrostomy with removal of tissue is completed. So that is what is mentioned in the code 31267. Okay, and then 31295, as we had discussed. What is? Go and check again. What is 31295? Nasal endoscopy surgical with dilation of maxillary sinus ostium transnasal. But see below the CPT code, below the CPT code 31295, there is a bracket, something which is written in bracket. You have to be very careful with the brackets given, what is mentioned in the brackets, because that is also important. See, do not report 31295 in conjunction with 31233, 31256, 31267 when performed on the ipsilateral side. See, so it means you should not code 31295 along with 31267. You should not code both the codes together. Okay. If it is performed on the same side, you should not report 31295 along with 31267. So option B is wrong. You can't code both these codes together. Only 31295 you have to code. So obviously the answer will be option A. If you can check option C, 31295, again 31256 is there, 31267 is there, everything is there. That is also wrong. And if you take option D, 31297, what is 31297? With dilation of the same nasal endoscopy with dilation of sphenoid sinus ostium. Example, balloon dilation. A sphenoid sinus. Here, maxillary sinus in the question. So, that is also wrong. So, here you got the correct answer as option A, 31295. Okay. This is how you need to check for the codes, because you should not skip the brackets. What is mentioned in the brackets, you should not skip. Okay. Anyway, moving to second question. Mary Ann is 20 months old and suffering from chronic inflammation of the trachea, which is causing difficulty in breathing. Dr. Ligo inserted a planned incisional tracheal tube for Mary Ann. This procedure was completed under general endotracheal anesthesia. The patient tolerated the procedure well and was returned to the recovery room in stable condition. How should Dr. Ligo report this procedure? Yeah. So here you have to code for the procedure, which is, what is the patient having? The patient is only 20 months old. Okay, less than 2 years old. And then suffering from chronic inflammation of trachea. Inflammation of trachea is the diagnosis, which causes difficulty in breathing. What is the procedure carried out here? The doctor inserted incisional tracheal tube. Inserted a planned incisional tracheal tube. Okay, and this was carried out under general anesthesia. So let's move to the let's find out the answer. What's the first code? 31610. Go and take 31610, the first CPT code, first option. 31610. Tracheostomy, insertion of incisional tracheal tube. Okay, so that is tracheostomy. Tracheostomy 31610. Tracheostomy, fenestration procedure with the skin flaps. No, there is nothing mentioned about skin flaps. So that is the wrong code. What is 31601? The second option, 31601. Tracheostomy, planned, separate procedure, younger than 2 years. Yes, this is what we need, because the patient is here younger than 2 years. 20 months old is less than 2 years. So those less than 2 years, you have to mark the CPT code as 31601 as the answer. 31600 is just tracheostomy, planned, separate procedure for those who are greater than 2 years. If in the question, if it is greater than 2 years, then you have to mark. The answer will be 31600. So here 31601. Still you can go and check the other codes as well. Option C 31830 and option D 31615. What is 31615? Tracheobronchoscopy. 31615 is tracheobronchoscopy. That's a wrong code. And what is 31830? 31830. 31830. Revision of tracheostomy star. No, this is not revision. This is insertion. So, as I told you, the correct answer is option B, 31601. Tracheostomy, planned procedure, separate procedure, younger than 2 years of age. Okay. Now, let's check into the move to the third question. A 41-year-old female is seen in the emergency room with severe epistaxis, nose bleeding. Okay, epistaxis. According to her, this is a common occurrence for her during the cold, dry months of winter, and this is why she is here for the third time this week. See, indirectly they are telling that this is the third time this week. It's a repeat, it's a follow-up, I mean the repeat visit. Extensive bilateral posterior cautery and packing is again required to control the hemorrhage. What CPT code is reported for the procedure? Okay, here in the question, just for your understanding, I have marked in the bracket, tip, do not code E and M. Here you should not code E and M, right? Because this is the third time the patient is visiting the doctor third time in the same week, visiting the same doctor for the same procedure. And then the doctor is again going to carry out the procedure, which is extensive bilateral posterior cautery packing, and packing is going to take place. So you should not code E&M. This is not an office visit. You cannot mark it as an E&M visit. Okay. Anyway, moving to the options. 30906, the first code. 30906. What is 30906? Control nasal hemorrhage posterior with posterior nasal pack and cautery. Any method subsequent. 30905 is initial and 30906 is subsequent. Yes, this is a subsequent visit for the same procedure. That's why it is mentioned third time this week. So it's a subsequent procedure. And it's marked with modifier 50 to show that it is a bilateral procedure. See, bilateral procedure is carried out. Extensive bilateral. In the question it is mentioned. So you have to mark it with modifier 50. Okay. Let's check what is option B. 30903. Control nasal hemorrhage anterior complex. No, this is posterior. In our question it is extensive bilateral posterior cautery. So 30903 is wrong. 30905 initial, the same which I had mentioned earlier. Initial, this is not initial, this is subsequent. So that's also wrong. Again 30905 code is wrong. So you got the correct answer as option A, 30906. Control of nasal hemorrhage posterior with posterior nasal packs and cautery. Any method subsequent. Okay. So you got the correct answer as option A. Now fourth question. The patient is a 59-year-old white male, 1 month status post pneumonectomy. Means after 1 month, after the procedure, the patient had done the procedure 1 month ago. That is what it means. Okay. As you know already, pneumonectomy procedure is being carried out 1 month ago. He had a post pneumonectomy empyema treated with a tunneled cup pleural catheter, which has been draining the cavity for 1 month with clear drainage. He has had no evidence of a block or pleural fistula. Therefore, a planned return to surgery results in the removal of the catheter. What is the correct CPT code? So here, planned return to the surgery. Planned return to the surgery for the removal of catheter. That is a procedure that is going to carry out here. Okay, for the pneumonectomy, the patient had pneumonectomy 1 month ago, and then the patient had pneumonectomy 1 month ago. So he had post pneumonectomy empyema treated with it was already treated with tunneled cuffed pleural catheter. Okay, so which has been draining the cavity for 1 month with clear drainage. So return to the surgery, planned return to surgery for the removal of catheter. That's a procedure that we are going to mark. We are going to find out the code. So first one, 32440. What is 32440? Removal of lung, pneumonectomy. It's only mentioned removal of lung, pneumonectomy, 32440. This is not a pneumonectomy procedure. This is the removal of catheter. Okay. So that is wrong. What is 32035? Second option, 32035. Thoracostomy with rib resection for empyema. Thoracostomy. No. That's also wrong. Option C, 32036. With the same thoracostomy with open flap drainage for empyema. No, that's also wrong. This is not thoracostomy procedure. What is 32552? The last option, 32552. Removal of indwelling tunneled pleural catheter with cuff. Yes. This is what exactly we need. What is the procedure carried out here? This is nothing. Pneumonectomy is not the procedure. currently that we need to code, or thoracostomy is not the procedure that we need to code. Instead, what is the last line in the question? A planned return to surgery results in the removal of catheter. So removal of catheter is what we need to code here. So 32552, removal of indwelling tunneled pleural catheter with cup. That is what we need to code here. Okay. So here the correct CPT code that you need to mark is 32552, and it is marked with the modifier 58. What is modifier 58 means? Modifier 58 means it's a like that paid modifier is used for the post-operative period, the planned return, or it's a related procedure performed during the post-operative period of the first procedure. I mean, it means the same procedure by the same physician. Planned visit, or what do you call it? Yeah, post-operative period. Post-operative period, that full period of time. Whenever any procedure is being carried out, you have to append it with a modifier 58. Okay, so here the correct answer is option D, 32552 with a modifier 58. Alright. Now moving to the fifth question. A 25-year-old male presents with a deviated nasal septum. The patient undergoes a nasal septum repair and submucous resection. So that is the procedure carried out here. Okay, the patient undergoes a nasal septum repair and submucous resection. So you have to, as I told you in the previous video, you have to mark it whenever you get this. Whenever you are going for examination, mark it, underline it with pencil. So while reading itself, you need to underline, okay, to save the time. Now, cartilage from the bony septum was detached and the nasoseptum was realigned and removed in a piecemeal fashion. Thereafter, 4-0 chronic was used to approximate mucous membranes. Next, submucous resection of the turbinates was handled in the usual fashion by removing the anterior third of the bony terminate and lateral mucosa followed by bipolar cauterization. So, what CPT codes are reported here? Okay. So, what is the procedure carried out? Nasal septum repair and submucous resection. The remaining is the procedure how it is carried out. Anyway, let's go to options. Let's find out the codes. What is the first CPT code? First option 30620. 30620. 30620 is septal or other intranasal dermatoplasty. Does not include obtaining graft. Dermatoplasty. What is 30999? Understood procedure? No. Okay. This is not a dermatoplasty. What is 30520? 30520 in option B. I'm in option B now. Okay. 30520. Septoplasty or submucous resection with or without cartilage scoring, contouring or replacement with the graft. Yes, submucous resection. Septoplasty or submucous resection. Yes, this is the procedure, right? And then what is 30140? Second option, second code 30. We have two procedures, right? So 30140. Submucous resection, inferior turbinate, partial or complete, any method. Okay. Yeah. Submucous resection of inferior turbinate, partial or complete. Yeah. So submucous resection code. Also you have to mark, and then nasal septum repair, that is septoplasty. That also you need to code. So two codes. Since it's a multiple procedure, you have to append the second modifier with the second code with the modifier 51. Okay. So since already you got the answer, but still we will check what are the other codes and just explain. What is 30420 option C? 30420. It is rhinoplasty primary. This is not rhinoplasty. This is septum repair. Septum repair means septoplasty. Okay. Then 30450 in option D. 30450. That is rhinoplasty. Again rhinoplasty. Secondary. This is not rhinoplasty. So since the correct option, correct code is only in option B, so the answer will be option B, 30520 for the septoplasty, nasal septum repair. Okay, and along with 30140 for the submucous resection code, appended with the modifier 51 to make sure that mark to make it as multiple procedure. 51 modifier is multiple procedure. All right. So that's it for today, friends. Thank you so much. And if you are new to the channel, please subscribe. If you like this video, please like and share it among all of your friends. And stay tuned for next video. Again, I'll be back with few important mock questions. Along with that, we will be doing simple practice questions as well, so that you will be knowing how to navigate through the CPT codebook, CPT and ICT codebook. Okay. So thank you so much, friends. Stay tuned. Bye. Take care.